Good day, sir. I am Montañez, and today I will be discussing the human platelet antigen or HPA genotyping and its role in diagnosis. For the introduction, human platelet antigen genotyping is a PCR-based molecular test used to identify genetic variation in platelet antigens. These antigens are found on platelet glycoproteins such as GP2B or 3A, GP1B, and GP1A or 2A, and they arise from single nucleotide polymorphisms or SNPs. This is clinically important in diagnosing conditions like fetal and neonatal alloimmune thrombocytopenia or FNAIT, post-transfusion purpura or PTP, platelet transfusion refractoriness or PTR. HPAs can trigger alloimmunization, which leads to the production of IgG antibodies. This usually happens due to pregnancy or blood transfusion. The effects include destructions of platelet and antibodies crossing the placenta and affecting the fetus. The most severe condition is neonatal alloimmune thrombocytopenia, which can lead to intracranial hemorrhage. For the background of the problem, diagnosing alloimmune platelet disorders is challenging, especially in resource-limited settings. Variation in HPA can cause serious conditions like FNAIT, PTP, and PTR. However, limited access to genotyping and antibody testing makes accurate diagnosis and management difficult. For the general objectives of this topic is to evaluate the role of HPA genotyping in diagnosing alloimmunization. Specifically, it aims to describe HPA genetics, explains the mechanism of alloimmunization, review laboratory methods like PCR and MAIPA. It identifies clinical applications such as NAIT, PTP, and PTR, and analyze the advantage of combined testing. For the diagnostic methods, these are two main diagnostic approaches. First is molecular testing or genotyping, such as PCR, SSP, and real-time PCR. This detects genetic differences in platelet antigens. Second is serologic testing, including MAIPA, which is the gold standard, ELISA, and PIFT. This detects platelet antibodies. Clinical significance. In terms of clinical application, FNAIT involves immune destructions of fetal platelet by maternal antibodies. PTP is a sudden platelet destruction after the transfusion. PTR is the failure of platelet count to increase after transfusion. It is important to remember that genotyping does not detect antibodies, it only identifies antigens mismatch, while antibody test detects platelet antibodies, so the best approach is to combine both methods for accurate diagnosis. For the conclusion, HPA genotyping plays an essential role in diagnosing platelet disorder. Combining genotyping with antibody testing improves diagnostic accuracy and helps in better patient management.